the resources that are available in the community. And for that, the navigators have been given resource tools and a lot of information through the app. We also ask the navigators to connect clients to the PCP or insurance if they don't have one, and also follow up to make sure that they showed up to their primary care appointments. And the one important thing, which is something we have been pushing for, is to close the referral loop. It's not enough to only make a referral. It's important that we actually close the loop, get in touch with the client or get in touch with the organization we made the referral to make sure that the client actually received the services. Next slide, yes. Thank you. And just to show some numbers to date from July 1st till end of last month, more than 7,500 SDOH surveys were completed, and these are all unique clients. It does not account for the duplicates. And across those surveys, more than 14,000 SDOH factors have been identified, which is kind of an average of about 2 factors per client. And of the 14,000, more than 4,000 referrals have been made. We are pushing moving forward for more referrals to be made as we identify the factors, and which is why we have been pushing for these webinars as well, so the navigators can be more aware of the resources that are available in the community. And as you can see, you can see the prevalence by factor through these surveys, and today's topic is clothing, and you can see more about 8.6% of the SDOH factors that were identified were actually clothing-related issues. Yeah, next. And there are some screenshots from the app. Those who are on the call and are using the app, you are a pro by now on this. We do collect consents from clients, asking them if it's okay for them that we share the information to make referrals. And you can see just some screenshots of 2 of the factors, or 2 out of 9 of the factors, that when the client identifies an issue, there is a pop-up for all the resources that the navigator can choose from and work with the client that's best and convenient for them. And at the end of the survey, the client also does get a text message or email message as they prefer with the referral summary. So that's something they can find handy and follow up with the agency that they have been made the referral to. And these are some screenshots of the referral resources that Selena and our communications person have put together. These can also be found in the SDOH app currently.
Okay, thanks, Anya.
Thank you.
Okay. So I'm going to give a little overview, but the social determinants of health are the circumstances where people are born, grow up, live, work, and then die, and the systems that put them in place to keep them in those situations. These circumstances, these social determinants of health, they're shaped by our politics, what and who we vote for, social policies, everything that we decide via voting and via the way our government is set up allots money for certain situations and certain funding avenues, right? So if we voted differently and we wanted to make a change through advocacy, you would have to make sure that you're supporting politicians with the same kind of viewpoints as you, who might want to work on some of these issues. I think by doing this work that's the only way that we can make a decent change, instead of just complaining or instead of just dealing with things the way that they are. You can really speak as a consumer with your dollar and with your vote. So we're going to go over a couple of things. There are some startling statistics. 80% of clients who were screened through the Staten Island Cares Project, which is a care coordination project for people who have a chronic disease, 80% of them are dealing with a social determinant of health factor. The average is that everybody that screens for social needs, they have at least 2 factors, so 2 social issues that are impacting their lives. And we know that these social factors equate more in the long run. They have more to do with your health and wellness than your genetic code or than your the medical care that you receive. They really account for almost 80% of what's happening in our lives. So we're going to talk today about clothing, socialization, and child services. Just so you know, clothing is not it's not a national social determinant of health issue. This is more Staten Island based. It's because we learned from the Staten Island Cares Project that the second highest need of our clients with social needs was clothing, and not just regular clothing, seasonally appropriate clothing. So that means in the winter, do I have access to jackets and scarves and hats and boots? You know, in the summer, sandals or whatever it is. And I think it has more of an impact on somebody's health in the winter. You know, imagine a child who's going to school who doesn't have the right size boots or the right size long pants or long johns or whatever, and you know they're going to school, they're cold, they're freezing, they're being bullied, they don't have access to the clothing that they need, so they're not paying attention in school. They're bullied, so maybe they have mental health issues. They might be depressed. I mean, there's just a domino effect, really, when people don't have access to clothing. The families have said that they keep their kids inside because they don't have the right resources to get outside and get moving. They feel shamed. So there's a lot of things happening. And, you know, 16 million children across the United States live in poverty. And when people are so focused on these other basic needs like food and housing, there's not enough time or money or effort or, you know, there's not enough left over to provide this warm winter clothing that people need. So we weren't able to get a presenter for the Salvation Army on Staten Island, but I did want to make a shout out because they have some interesting things happening. I know a lot of you do refer to the Salvation Army on Staten Island. There are 3 notable locations. You have the Stapleton Corps, the Port Richmond Corps, and then the thrift store, which is actually right by our office in 10304. So the Stapleton Corps, they each do something different. So this is why I have these 3 categories here. They give vouchers for people to use at the thrift store. The way the voucher system works at the Stapleton Salvation Army is that clients, if you're going to make a referral to this Salvation Army, you have to send them a letter from your organization describing the family and what their needs are. They also ask for a donation of 50% of what the final voucher is. They give everything highly discounted. So an organization like the Staten Island TPS is considering budgeting some money to address this clothing need that's happening on Staten Island so that we could potentially cover the cost of this 50% of the voucher. So they give the family a voucher, and then they would have to go to the thrift store at 493 Mosel Avenue. The Port Richmond Corps, they do provide clothing at no cost. They don't give out vouchers anymore. And if you call ahead, a social worker can put together some items for the client and advise them when they can come and pick things up. So it's very different than the Stapleton Corps. The thrift store, and however, without a voucher, anybody can go to the thrift store. Wednesdays and some Saturdays are half off. You don't need a voucher. Everything in the whole entire facility is half off. And then even on regular days, most of the items that they have available in the Salvation Army are highly discounted. Also to note, when you recycle clothing or you buy secondhand or thrift shop clothing, you're also helping the environment because the production of clothing and our need to always have the newest, latest, and greatest threads is really doing environmental damage to our climate. So I just want to put a shout out there for that. So how can you get involved in providing clothing? You can organize a new jacket drive. So the thing is, why can't you donate? Why can't you just donate your old jackets? The thing is, with the new jacket drive, especially for children, they sometimes never have something new that's just for them. You can try to organize a jacket drive with your local PTA, school, or place of worship. This is a nice idea for the coming festive, holiday, and gift-giving season. Everything is discounted, and if you're buying your family member or a loved one or a neighbor a jacket, you might want to pick up an extra one and donate it somewhere that might need it. Here are 3 organizations on Staten Island that will come and pick up your used items. So again, if you have gently used items or things that you're trying to recycle out of your closet, don't throw them away. They end up in the landfill. You please call and schedule a pickup at St. Mary's, the Vietnam Veterans, the VA, or the Salvation Army. And I've included links, and then you can go on. Everything is automated, which is pretty cool. So you go on and set up your pickup day, and they tell you when they're going to be in your zip code. Also, everybody that's on this webinar, you have an office, organize a drive. You can organize a new jacket drive, a lightly used clothing drive. Somebody can be a volunteer to drop it off. You don't necessarily have to have a group of people that you want to donate to. So that's my spiel. I'm going to get off my soapbox now and move on to this wonderful, wonderful organization called Families on the Move of New York City. They're going to speak about their clothing closet, also known amongst our navigators as Open Closet. Tina can give us some more information on what the name of the official name is. But Families on the Move, they provide amazing services on Staten Island. So Tina is here. She's going to give us some more information. Thanks.
Good afternoon, everyone. Can you hear me, Selena?
Yep, it's perfect. Go ahead.
Great, awesome. So again, my name is Tina Gibbs, and I'm the Associate Director at Families on the Move of New York City, Inc. And it is certainly my pleasure today to introduce you to Families on the Move and also to our Open Closet. So for those of you that don't know, Families on the Move of New York City, Inc. is solely dedicated to providing support, education, and advocacy for families and youth across systems who have experienced or are at risk of experiencing emotional, behavior, mental health challenges, and substance abuse challenges. And so, more specifically, the Young Adult Supported Education and Employment Program, which is one of Families on the Move's programs, it is actually a warm and engaging one-stop job spot. So what do we mean by that? We support individuals with all job-related needs, such as paid internships, job readiness, resume development, professional interview clothing, career coaching, and much, much more. So let's talk a little bit about that. Next. So when one thinks about a closet, what really comes to mind, right? A closet is an enclosed space used for storage, particularly that of clothes, and that is exactly what we have done here at Families on the Move. However, the difference is that we've opened it to the public, and we've done that in an effort to actually service our community here on Staten Island. And the reason for that is because, as I mentioned before, we can help to create a wonderful resume. We can assist with interview prep. But what happens when someone doesn't have the means to properly represent themselves with presentable clothing as they go on an interview? They may, in fact, get discouraged and not attend, or they may, in fact, feel self-conscious and not have that confidence that they should have when attending or going to an interview so that they can ensure that they get the job. Next slide. So what are we doing to kind of combat this issue? Over the past 3 years, our clothing closet has serviced over 300 persons in need of business attire who either have had an interview scheduled or who have recently started new employment. In 2016, we serviced 58 people. We received 4 clothing donations from the public. In 2017, we serviced 78 people, receiving 7 clothing donations from the public. In 2018, we serviced 73 people, receiving 10 clothing donations from the public. And so far in 2019, we've serviced over 123 people so far, and we've received 10 clothing donations. But guess what? That number is steadily climbing. I'm actually heading out first thing in the morning to go pick up about 11 bags of clothing of someone that just graciously wanted to donate to us. Next slide. So while we've partnered with many different agencies across Staten Island, we have 6 major partners that consistently send us referrals. And those organizations are anywhere from the Jewish Board, Community Health Action of Staten Island, Maximus, Workforce One, America Works, and Project Hospitality. Again, just to name a few, but these are the major ones, the major partners that we see consistently send us referrals on a day-to-day basis. Next slide. Our referral process is very, very simple. Job seekers and the newly employed can actually walk into our office. We're located at 358 St. Mark's Place, Suite 302, Staten Island, New York, 10301 is the zip. And they can walk in Monday through Thursday between the hours of 10 a.m. and 2 p.m. as long as they have a referral. Now, that referral can actually come from us. I'll be more than happy to share that with you all today, or from a referring agency. And this is basically what our referral form looks like. It just simply asks for the date, the name and contact information of the job seeker, what services they're looking for, and then we also ask for the name and contact number from the person that's actually providing the referral to that job seeker. Next slide. So, we service persons who have interviews scheduled to obtain employment, and again, those who have recently gained employment and that are in need of business attire. All are welcome as long as they have a referral. We will not turn anyone away, again, as long as they have a referral, even those that are undocumented. Just to give you a kind of an idea of some of the clothing that we have available, we have business professional clothing, business casual clothing, which includes slacks, skirts, shirts, blouses, shoes, ties, belts, and we even have handbags. Give you an idea, this is what someone can actually walk away with. And we do our best to not limit the number of outfits that the job seeker would like to walk away with, if need be. And again, to just give you an idea of how many people are in need of clothing, just last week, between Monday and Thursday, we serviced 10 people. And if I could go even on a higher number, just yesterday, between 10 a.m. and 1 p.m., we serviced 5 people. Literally, they were just coming in the door back to back. And I was sitting here wondering, like, wow, what is the, the uptick coming from? And I thought about it and I said, wow, you know what? It's probably due to holiday hiring. And so we realized that that's an important need during this time as well. And if I could give you, just share with you a quick success story. A few months back, we had a job seeker come in that was in need of clothing. She had an interview scheduled, I believe it was at TJ Maxx, if I'm not mistaken. And when she left us, she walked away with 3 complete outfits. She was also in need of car fare at the time. And so we were able to provide her with that, and we assisted her in that way. And not only did she call us back, she got hired. And just as a congratulations, we provided her with a car fare for her first few days of employment. And so those are really the successes that kind of, just do our hearts well and make us happy that we are, in fact, able to assist in person's time of need. Next slide. So, how can you help? Here's how. We accept new and gently used clean clothing from people just like you. So we ask that you please show your support as we continue to service those in need. We can't do it without you, and that's really just the bottom line. And so if anyone is interested in donating, again, any new or gently used clothing items, we will be more than happy to get them from you, or you can feel free to drop them off at our office. You can feel free to contact me directly at 347-682-4951, or I can be reached via email at tgibbs, that's TGIBBS, at FOTMNYC.org. I thank you so much, ladies and gentlemen, for allowing us to present our clothing closet to you today, and we look forward to hearing from all of you.
Thanks so much, Tina. That was really wonderful. It's so awesome to know that there's an organization on Staten Island that helps people who are job seekers make sure that they feel and look their best when they're going for an interview and they're just starting out in a new role or career. We all know how stressful that is in general, and then, feeling the shame of not having or being able to afford the right kind of clothing that you need to impress the interviewer in the first place. No, that's just a whole nother level of stress that people now, thanks to Families on the Move, don't have to deal with. Anybody's interested in asking Tina a question, go ahead and type it right into the chat box. If you're interested now in going through your closets and donating your gently used and clean work and business attire, please go ahead and do that. I know I'm going to do that maybe this weekend. Sounds great. Okay, so thanks again, Tina. We're going to talk a little bit about socialization and hear from our partners at the Venture House. So Alex, please, you're unmuted. Feel free to take it away. Thank you.
Thank you. Hi, this is Alex. I'm the team leader at Venture House.
Hi, my name is Fakani Raval. I'm the program director at Venture House.
Okay, next slide. Thank you. So first of all, who we are, we're a not-for-profit community-based mental health agency, and we're open to assisting people who are diagnosed with a mental illness. We assist them with their recovery goals regarding what they are. Some of those include employment, education, recreation, affordable housing, meaningful relationships, and community engagement in an environment of mutual acceptance and empowerment. Next slide.
So Venture House, of course, you guys can read, and it says we're dedicated to the wellness and recovery of people living with mental illness. We are non-clinical, meaning we don't do any clinical therapy here, but working side by side when the members come here and they work side by side with staff and other members, they do have a sense of recovery because they end up building relationships, gaining their skills, confidence, and build up respect for coworkers, neighbors, and friends as well. So our vision is that communities will believe in recovery and welcome people living with mental illness without stigma or judgment. So they feel free to come into a safe horizon where everybody is the same. There is no hierarchy level here. There's no member or staff only places. I believe that me as the program director is the only person here in the clubhouse that has an office due to, certain administration tasks that I have to do. But, members do run the clubhouse. They run the clubhouse and we help them run the clubhouse. Next slide, please.
So the Clubhouse model, it's an international coalition called Clubhouse International. The first Clubhouse was started actually in New York City in Manhattan. It's called Fountain House in 1947, and that branched out to being a global coalition. I think one of our most recent clubhouses is in Mongolia. They're in every continent, except Antarctica, obviously. It's all over, and it's great how far-reaching it's become. It's in only 60, 70 years or so. So the clubhouse model is rooted in the concept that ongoing engagement and purposeful activities brings meaning to life, and that lasting social connection promotes health and wellness. As Fakeni was saying, our members work side by side with the staff in running absolutely every aspect of the program. So we actually see our membership as more of colleagues. All of us really are the same. There's no level of hierarchy. Even though, Fakeni is the program director, she could be working in the kitchen, cooking alongside a member, with staff, all of us together. There's no level of tasks that members cannot do here, with the exception of, HIPAA-related things dealing with other member psychiatric documentation. So when we say our members run every aspect of the clubhouse, it's 100% true. So that includes intake and admissions, meal prep, facility maintenance, program development and implementation, tutoring, as well as social and recreational activity. They're involved in every level of decision making. Members can suggest policies And then we have a big meeting of everybody where we discuss, is this policy necessary? What is it for? We implement the policy based on consensus. And members are even involved they can be members of our board of directors. The top tier, the highest level you can get within the clubhouse, and members can be on the board as well. Every level of decision making, policy, all of it. So it's really great because it's very different from any other mental health facility where people are used to, you go to program at this time, you eat lunch at this time, take medication at this time, see your psychiatrist. Here, it's voluntary. People can do what they want, and we help them. Members help each other. It's a great environment. Next slide, please.
Yeah. So membership. Actually, this is your Alex. This is your slide.
I talk about this. That's fine. So yeah, membership is open to all New York City residents age 18 and older who are diagnosed with a serious mental illness. So like I had said, it is completely voluntary without time limits. So a person can become a member, not show up for 5 years and come back, and their membership becomes active once they walk in the door. There's no such thing as discharge because serious mental illness is a lifelong illness. So our membership is lifelong. There isn't really limitations for membership. If you're undocumented, you would follow the same referral, the same process. We also, I didn't add this in the slide, but we are free for the members, so we don't bill Medicaid or anything like that. So that's not something anyone would have to worry about. The only disqualification for membership is if, and this will be coming from the person's paperwork that we get, if they are a current significant threat to the community. So if a person has violence, in their history, but they're trying to turn their life around, they're changing, they want to do better, what their past is their past. It's how they are doing right now. So and we would do it, it's an individualized basis. We would have conversations with the person, but if we can determine right now they'd be a threat to our clubhouse community, they wouldn't be eligible. However, of course, that could change down the line if they do get the help that they need. And we are located in Staten Island, but we have another location in Jamaica, Queens. That was actually our first location. They were established in 1989. So if you are a member of either clubhouse, you can attend both locations.
Yes, and there are 12 clubhouses in New York City. In the event that there is a member that's moving from borough to borough, they can assist other clubhouses as well, attend other clubhouses. Next slide, please. Referrals. All right, so our referral process just started to get a little more rigid because we, as a startup clubhouse, we were just trying to build our average daily attendance. So it was a kind of a walk-in, come and we'll give you a tour. A member will come and give that prospective member a tour of the place. Then after that, they'll sit down and fill out an application. But basically, we get our referrals from agencies that were mentioned previously from the other presenters, like Project, Hospitality, the PROS program, Bridges to Wellness program. There are other programs that refer their prospective members to us. You can be referred by a provider or the member. Usually our referrals come basically from word of mouth. Other members attend similar programs, and they talk about how good they feel and how expected and wanted and needed they feel here at Venture House. So the word of mouth is really helping us more than any other referrals. Not that the other referrals are not helping, it's just something that I kind of noticed. So the first step is to visit the clubhouse and take a tour. We don't have like a tour date yet, but every Monday through Friday, 9 to 5, you can call us at 718-658-7821, or my direct extension, which is 646-214-8164. Of course, we take walk-ins. We started our first orientation yesterday, so it's a little bit more structured than before. However, we're still under that same ambiance of walk-in. If you decide to become a member, there's a simple enrollment process. We require the following documentations with it, which is psych eval,
psychosocial assessment with the psych eval has to have their access on diagnoses, and the psychosocial assessment with an annual physical. Yeah. Next slide.
So our day-to-day operations, we're relatively structured. So our normal day-to-day, Monday through Friday, 9 to 5. It's designed that way intentionally because it does mirror, typical American working hours. And it helps people get into the habit of, waking up, going in, doing work, having a lunch break. And some of our members, they are people who've never worked. And then we have some people who have PhDs and speak several languages and have a whole history of work, but then something happened with their mental illness and they had to step back from that. So it's either it's helping people get back into it or helping people get started with it. So we're open the Monday through Friday, 9 to 5. We have every day at 9:30, we have a big group meeting where we go over the agenda for the day. And then after that meeting, we're organized into several units. So depending on where that member chooses to be, everybody goes to their respective unit, and then we have another small meeting where people would volunteer for the various work that has to get done depending on the unit you're in. So there's administrative services, which is a lot of clerical work. We have a reception desk that the members do. There's data entry. We make phone calls. We design a newsletter. Another unit is employment and education, where we assist members with their employment education goals. We do mock interviews, resume building. We help with job applications, driving people to interviews. And then our last working unit is kitchen, dining room, housing, and maintenance, which does all of the meal prep, and then the cleaning, any other little maintenance tasks that have to get done. And again, when we do these meetings and these tasks, membership is encouraged to take the lead. And it's taken us some time, and we're only 2 years old. We just had our 2-year anniversary a couple of weeks ago, in October. But I've seen the change in people. I started here 1 year and 6 months ago, and staff was leading everything and trying to get members involved, and that'll be an ever-going project. But at this point, we're at the level where as staff, I don't have to say anything. A member will get up and start running the meetings and help out. Like, I'll have members ask me to help them with something, and I'll say, give me 1 second, and a member jumps up and goes and helps them. And so we've seen the change. We've seen what our program does with building people's confidence, and whether it's gaining new skills or gaining back the confidence to employ the skills they already have. You can see that just being able to run the program the way they want to, and having a voice and having input and deciding what they're doing and deciding where they're working, it really does, make a difference. And so the idea is that through the work of the day, through running the clubhouse side by side with members and staff, you're building relationships and you're gaining confidence, and that's how people are able to recover. So the main hours is the 9 to 5, the business day, the work. But of course, we also have social programming. You can't just have work, you need to have a good time as well. So Tuesdays, Wednesdays, and Thursdays between 5 to 8 p.m. and Saturdays 10 to 3 is social. We're also open every single holiday. The only day we're closed is Sundays. We're not open Sundays, but we're open every holiday. That schedule is also 10 to 3. So during that time, we could either be in the clubhouse watching movies, playing games, board games, whatever it is the members want to do. And we also organize trips as well. Actually, Thanksgiving is coming up. And Thanksgiving is one of the biggest holidays for Clubhouse. It's non-denominational. It's a really big event. It's a whole feast. It's the only day where staff really waits on the membership, and if they want to help out, of course they can, but it's the one time where we really want to make sure that, they can sit down with their peers and have conversations, and we serve them. It's a very, very, very big day. So if anybody does have any referrals and for us, and they do become members and they don't have something to do on Thanksgiving, we're here. We see ourselves as a community and as a family. Yeah. So the social hours it's you build relationships during the working hours, but the social hours, that's where you're really cementing it. You're having a good time with your peers and colleagues. So
yeah. Yep. And we also serve free food, no charge, and it's very good. We got the best food on Staten Island. So next slide, please.
Oh, that's the last slide.
That's the last slide. Okay, so one other thing before finishing up, we forgot to speak about something very important, which is our standards. We do have 37 standards at the Clubhouse International, all clubhouses around the globe run by. So we have 355 clubhouses around the world, and these 37 standards are divided into 7 sections, and one of them is membership, the other one is relationship, and so on and so forth. But one of my favorites is the standard that says that we are understaffed purposely. We will never be fully staffed here at Clubhouse. If we are fully staffed, then that means we don't need the members. So that's one of my favorites. It helps the member understand that if they're, even though this program is voluntary, if they don't help out, then the Clubhouse won't be able to run as accurate as it's supposed to be. So
it's again, we're only 2 years in, and I've seen a lot of progress, but it's meant to get to the point where you don't need the staff anymore. I mean, we'll always be here, of course, but the idea for every clubhouse is that you get to a point where if all of the staff are just magically not there, the members can run everything just as smoothly as the staff can. And that's, we're designed to not be able to tell the difference between who's member and who's staff. And it's true. I've had people ask me if I'm a member. I've seen people ask members if they're staff, and it's very refreshing. It's such a different environment from other mental health facilities. It's really, really great, and our members love it. I've seen the change in a lot of people.
And a lot of recovery takes place in this big family, in this big, big house. So thank you so much for having us.
Thank you.
And listening to us.
Thank you so much, Venture House. What an awesome group that is. It's so interesting to hear that this kind of organization exists where it's co-led, co-curated, and co-facilitated by people who need services, want to learn from other people. I really love it. And thanks for sharing how to make referrals into the program. I think that's important. I know you guys are part of the project, so probably have a lot of information to share with our partners on those referral rates and some other successes that you guys have had. So thanks for sharing. I'm going to move on. I just wanted to share that Staten Island does have a veteran center, although I was able to speak to Samuel Coates, who is the community referral resource leader there. They weren't able to present to us today, so I just wanted to throw up some information about the resources that are available to Staten Island veterans. They have services at 60 Bay Street that include all kinds of services for combat veterans and families. They do a lot of interagency referrals there. They can help combat vets with benefits that they deserve, that they're owed, and get a lot of different screenings. They also have groups there where it'll be like family or individual counseling for certain subjects. So if you have somebody that's a vet that you're working with, please don't hesitate to reach out to the Staten Island Vet Center. And then I'm going to get into the child care and services. We have 2 organizations that I'm going to share information with you about. The first one is the Seaman Society. They do an awful lot on Staten Island. They're also part of this project, the Social Determinant of Health Project. But Nellie was unable to present today, so here's some information. They offer family daycare. Now, on Staten Island, I know that there is a high need for child care services. Without getting a nanny, there are very limited options for family daycare and child care service. This wouldn't be like a babysitter. So still, we are looking for resources where if somebody had to go to the doctor or go food shopping or something and they couldn't bring their child with them, what organization provides that kind of like on the spot, last minute, 1 hour in length childcare service without having to pay for a nanny or a babysitter? If anybody knows those kind of resources on Staten Island, please share them with me so we can share them through this project. The information that I do have to share on childcare and services is Seaman Society's Family Daycare. So they provide services for children from aged birth to 3 years old. it's a sliding scale-based payment, so depending on how much mom and dad or the family member or caregiver makes is how much the cost of daycare will be. They're provided by trained and licensed family child care providers. They have structured activities that kind of mimic the Department of Ed's child care and daycare services. I believe that they are getting now DOE funding. I'll have to check back to make sure if that's true. But here's a flyer. It's available on this webinar, and then I can also send it out to attendees after this. It has information on how to find out if there's space and how to enroll in the program. The next service that I wanted to share with you is an interesting resource that is provided by the Community Health Center of Richmond. Community Health Center of Richmond has multiple locations across Staten Island, one in New Dorp, one in Stapleton, one in Port Richmond. They also offer this variety of programs for infants, mothers, and children. Just at two sites, two out of the sites that I mentioned before, their Port Richmond site and their Canal Street site. They have a lot of different programs for mothers. They're concerned with prenatal care, so women who are pregnant or thinking about getting pregnant, women in families who are planning their pregnancy. They're very keen on education for prenatal care. They also have programs where they can support families purchasing items, or they give items to families who might not be able to afford them. They also participate in a 311 initiative. It's called Cribs for Kids, where they are a distribution site. They give out pack and plays for families who are in need. And then they have a wealth of classes for infants, mothers, and children and parents-to-be. So breastfeeding support, safe sleep, how to manage stress, newborn care. So they do a whole gamut of different education initiatives that more people need to know about and more people need access to. I'm not sure if anybody knows that Staten Island has very high infant and maternal mortality rates, which is alarming since we are this developed country and this developed nation. Someone once said that we have similar health statistics to that of a third world country as far as on Staten Island in the infant mortality rates. And I know Community Health Center of Richmond is very involved in the perinatal network. They're going to be doing some investigations as to why those statistics and those outcomes are the way that they are. But they have all these wonderful programs, and I hope if you're not already referring your clients to them, that you begin after learning some more about them. So that concludes today's presentation. It was just under an hour. We presented a lot of stuff to you. This webinar is recorded, so it's going to be put on our website, and we'll send you guys a message to let you know when it's up, that you can access it. So I'm going to just be answering. I'm going to be looking through the questions right now. I think we had one question come in from Alexandria from Venture House, who asked Tina from Families on the Move, how do they become a referral agency to be able to refer people to the program? I'm going to unmute Tina.
Hi.
Okay, great.
So you can feel free to give me a call, and I'll set you up with the process. We can either, again, give you a copy of our referral, and you can utilize that, or if your agency already has a referral that you want to utilize, just shoot me over a copy. This way I'm familiar with how it looks and what is required. Again, my phone number is 347-682-4951, and my email address is tgibbs, that's TGIBBS, at FOTMNYC.org.
Okay, Tina, I just put that in the comment section in the chat box.
Great, thank you.
And the only other statement that came through was from Alex, letting everybody know that if you have any questions for her about their services for people experiencing mental health issues or the clubhouse, please go ahead and email her, and she left her email address. I'll wait another minute. Does anybody have any other questions for any of the information that we covered today? Yep, Jacqueline, I will give you the information, the contact information for the Community Health Center of Richmond. I'll follow up via email with you. Okay, we're going to log off, and you all have my email address, my personal email address. If anything comes up, you have ideas for new contacts, new resources, or you have questions about the information that we covered today, please go ahead and shoot me an email, and we'll make sure to get you connected. Okay, thanks, everybody. Keep up with the great work that you guys are doing. We're really going to be able to help a lot of people on Staten Island through these meaningful connections. Thank you for participating. If you were with us for all 4 webinars in a series, from the bottom of my heart, thank you. Hope to see you all soon. Bye-bye.